Sir, it's 3. Meeting is. Sir, shall we start? It's 3. Am I audible?
Yes, madam.
Okay.
You're audible.
Okay, okay. Dr. Anjan Adhikari sir is here. He was.
It's not seen now.
No, he had logged in. He was.
Yes, he was there.
Yes,
It's not seen.
we saw him, no?
Yes, we saw him.
Yes, he was here.
Now he is logged out. I think.
Sir, shall we start? Sir, you are mute. Dr. Adhikari sir, you are mute. Mr. Praveen Udupa, please unmute Dr. Adhikari. Dr. Anjan Adhikari.
Yeah.
Yes, sir.
Yes.
Yes, sir. Yes, sir.
We can start now.
Yes, sir. Yes, sir.
Madam, please.
Yes, sir. So, welcome everyone to this program. There's yet another feast waiting for you. Welcome the resource persons, welcome the moderators, and I also welcome all the dear participants for this program. The first talk of the day is profile-based learning and assessment in pharmacology portfolio-based learning and assessment in pharmacology. And to do the honors, we have none other than Dr. Savita Verma. She is herself a high-profile pharmacologist of the country. And as I told you, I assure you a feast, an academic feast by both good speakers today. The moderator is none other than Dr. Anjan Adhikari. I wish to introduce the moderator first. Slides, please. Yes. Dr. Anjan Adhikari, apart from his MD, he is also a FAMO fellow, and he is medical superintendent cum vice principal and professor of pharmacology at West Bengal, a medical college in Kolkata, West Bengal. He is the coordinator of MEU. He is a member, chairman, convener of many committees. He is the resource person for the medical teachers training program. That is, he is TOT or trainer of trainers. It got changed. Yes. And he is a member of the quality review panel PVPI IPC. And he's a member of the subject expert committee CDSCO. He is the member of medicinal plant subcommittee, Department of Science and Technology, that is DST. He's a faculty and of course examiner as UG, PG and also PhD guide. So we have with us Dr. Anjan Adhikari to moderate the session. Over to you, sir. He's a very learned senior person, a senior pharmacologist of the country. Over to you, sir.
Yeah. Thank you. Am I audible?
Yes, sir, you're audible.
Yeah. Thank you, madam, for introducing me. Good afternoon, my respected teachers, colleagues, friends, and students. Today, we are going to learn a lot of things about portfolio. And the person who is going to teach us today or to show us the way what exactly portfolio means and how to assess or rather explaining the different facets related with CBME in pharmacology is Professor Savita Verma, a very good friend of mine. Savita is MD, PDCR, FIMSA, and famous CMCL fellow. She is deputy dean and professor of pharmacology at one of the prestigious institute, Pandit B.D. Sharma Postgraduate Institute of Medical Sciences, Rohtak. I think all of you are aware about the institute and also about Savita. She is member and expert committee for examination and evaluation of periodic safety update report, PSUR, post-marketing surveillance data, subject expert committee of CDSU, New Delhi. Nodal officer, ICMR, Center for Clinical Trial. I think you are also heard about her contribution in clinical trial and the drug development for last few years. She is the member and of Scientific and Research Advisory Committee of University of Health Sciences of Institutional Committee on Stem Cell Research, Rohtak. Member Secretary, Biomedical Research Ethics Committee and Institutional Ethics Committee, Rohtak. I think pharmacologists are very much inclined with medical education and ethics. We all are to some extent involved. Then awarded Women Achievers Award, Best Teachers for the year 2022, State President's Award, COVID-19 Warrior Award, so many awards. Academic areas of interest is clinical pharmacology, clinical trials, pharmacovigilance, psychopharmacology, bioethics, and medical education. Savita is going to introduce us with the concept of portfolio. Though it's my understanding that a number of us, the teachers, medical teachers, don't have clear understanding about portfolio. And we have deficit. How can we design the portfolio with the help of the students? Because it is a self-learning process. And again, how to use this tool, a very strong tool in the assessment system or the feedback system. So may I request Professor Savita to start her session and enlighten us about different facets of this subject. Savita, please. Savita, you are not audible. Yeah, now you are on.
Yeah, thank you, Dr. Anjan. Good afternoon, everyone. And I'd like to, at the outset, I would like to thank the organizers for considering me for this workshop. And it's great to have Dr. Anjan as a moderator for this session, because I'm sure if I fumble somewhere, he can always take over. So the topic for today's discussion is portfolio-based learning and assessment in pharmacology. So the learning objectives for today's sessions are, at the end of this presentation, the learner will be able to differentiate between portfolio, logbook, and curriculum vitae. We'll be able to develop a learning portfolio in pharmacology, and we'll be able to assess these portfolios. So verbatim portfolio basically means a compilation of academic and professional materials over time that exemplifies your beliefs, skills, qualifications, education, training, and experiences. It provides an insight into your personality and work ethics. So what is the difference between a portfolio or a logbook or a curriculum vitae? I'm sure you are aware of all these three terms. So portfolio, this is a picture of a cover page of a portfolio. This is how a logbook looks like. And this is a picture of a curriculum vitae. Now, please remember, all three of them are your own work. These are tools which are used in education and for professional development. They depict your work. It might be of the same time period or it might be of a different time period, but this is your ownership and this is your work. So what is the difference between these three? Let's see an example. All of you are aware now that basic course in biomedical research is mandatory for all the postgraduates, residents, as well as for the faculty. And for the postgraduates, because they have to appear in their exams, and for the faculty for the promotions. So this is how a basic course in biomedical research looks like in a logbook, or sorry, in a curriculum vitae. This is a logbook where it is one of the essential criterias. And this is how we generally represent it in a logbook. And whereas in a portfolio, after an about me section, you can depict or give a pictorial presentation of the portfolio. So this is how, it is one of the examples how it looks like in a portfolio. So please remember, all three of them are your own work, but they have different characteristics and we use them for different purposes. So let's quickly have a difference between them. What is the purpose of a curriculum vitae? It is a concise overview of your professional and academic background, whereas logbook is used for recording specific activities, events, or data in a systematic and organized manner. While portfolio gives a comprehensive view of a learner's growth and development over time. So generally, curriculum vitae and logbook are more of a static documents which are updated periodically, while portfolio is a dynamic document which you can update regularly depending upon your growth and development. A little bit about the content. Usually in the curriculum vitae, it is structured in a straightforward and standardized format. Whereas a logbook, we have already predefined criteria in these logbooks, which we provide to the residents. For example, in medical education, it may record the number of procedures which are performed, patient scenes, or hours for training completed. While portfolio focuses on capturing the depth and breadth of a learner's experiences and skills, this is made by the learner themselves, and they can use any kind of skill in this portfolio. We'll see that in the examples. Coming on to the assessment criteria, it is CV is a crucial document which is just used as a screening tool, maybe by a potential employer when you're applying for a job. Logbook is generally assessed objectively because we have predefined criteria for logbooks, and we look for specific competencies and milestones which have been obtained by the learner in their journey. Whereas portfolio generally is assessed subjectively, though we have few rubrics which can be used objectively with the educators or reviewers evaluating the content and depth of reflection. So reflection forms a very important part of portfolio. So what does reflection basically means? Reflections, when we are working, we learn different things, but when we reflect or critically think about those things what we have learned, they basically contribute to reflections. I'm not going to go into detail of reflections because the next session is on the same topic itself. So in a curriculum vitae, we generally don't put reflections. It is tailored typically to an academic program for a job to which you are applying. Whereas logbooks generally have brief notes or comments related to specific entries. So a lot of emphasis is not given on reflections in logbook as well, but a lot of emphasis is given on reflections in portfolio. It is a key component of a portfolio and helps the learner connect with their experiences to their development and personal growth. So what is basically reflections in a portfolio? If you learn something in a learning portfolio, you generally reflect or you write about what happened. What did I learn during that process? So what does it mean? How is it going to help me? And what next? What are the next steps I'm going to take as far as the journey of that learning process is concerned? Let's see that with an example. Like we all did BCBR course. So how can we apply the knowledge of this BCBR course? Based on this BCBR course, you're going to do your thesis work or you're going to do your projects. You're going to take feedback regarding your thesis from your guides or the projects you take up during your residency. And you reflect on these thesis or portfolio or projects, whatever you are taking up. And then you achieve something or you make some presentations based on your thesis and research work. So you might win a best poster presentation somewhere, best oral presentation, or best research paper awards. So this is what you are building up on the knowledge of BCBR. You're making some achievements and you're showcasing those achievements through your portfolio. So what are the basic components of a portfolio? I'm just taking a brief overview. What you can include so many other things in your portfolios. It generally has a cover page. It has an about me section, which is personal to you. It has purpose, you have to define what is the goal of that portfolio or what are the learning objectives of that portfolio. Evidence or artifacts are the evidence of your work which you collect and you want to project in that portfolio. Reflection statements, as we have discussed, this is an important part of a portfolio. And sometimes we generally have a predefined assessment criteria for that particular portfolio. So some of the artifacts which you can use in pharmacology during your residency programs include your research projects. We have already discussed about it. Then your professional development certificates, which you have obtained from workshops, conferences, or courses related to pharmacology. Now, district residency program is a mandatory requirement for all the residents now. So records of your community service or reflections on those experiences can be a part of your portfolio. Pharmacovigilance activity, we all are actively involved in these activities. And last month itself, we celebrated Pharmacovigilance Week. So many of you must have presented some e-posters or some animation videos and must have won some prizes in your institutes or from the IPC Ghaziabad or from this program. So all these can be showcased in your portfolios. Then case studies, detailed analysis of medical cases, including patients, histories, diagnosis, treatment plans, clinical reflections on your clinical rotations, because again, this has become mandatory in the residency program now. Then feedbacks and evaluations from the seniors, peers, along with how to act upon these feedbacks to improve your skills. Then personal statements. The personal statements again form a very important part of your personal portfolio because they reflect on your journey as a learner. So these are some of the artifacts which you can use in your portfolios in pharmacology. So what is a portfolio-based learning? It is nothing but a scrapbook of your learning journey in the field of pharmacology. It can give a comprehensive overview of your learning journey and development as a future pharmacologist. And it is not just about your test scores like we see in logbooks. It is about practical applications, personal goals, self-reflection, and growth. So portfolio in pharmacology can be a collection of only your best work. It can be a presentation of all of your work that is organized and annotated. It can be a showcase of your learning journey and development and representation of your professionalism. So it depends on you what you want to depict in that particular portfolio. It is not a predefined or a structured criteria. So coming on to another topic, which is portfolio assessment. So like I said, that portfolio-based assessments are generally subjective in nature, but we can have some rubrics. So as far as Miller's pyramid of assessments are concerned, portfolio-based assessments come in the highest category of DOES, which means that portfolio-based shows the highest level of skills, and we can assess the highest levels of skills based on the workplace-based assessment or 360-degree evaluations. So two types of assessment can happen. One is most important is self-assessment. You can, since you are building up your portfolio, you are the best judge of your portfolio and you can improve it with critical thinking. And now the CBME curriculum in pharmacology is mandating that all the teachers of the department should be involved in assessment of the portfolios which are built up by the residents. So portfolio self-assessment, we have already done about this, that you you gather your artifacts or evidence relevant to your goals. You engage in self-reflection, critically look at what you have learned and explain the significance of each artifact. You seek feedback from your peers, instructors, and assessors, and based on that feedback, you improve and refine your portfolio. So you can indulge in self-assessment of your portfolios. And assessment criteria should be clearly defined. So we do have some scoring guides or rubrics which can be used for evaluating the portfolios objectively. And what is most important is that the assessment criteria needs to be aligned with the learning objectives and goals. So I personally feel in the implementation of CBME curriculum, both in the undergraduate and postgraduates, assessment criteria plays a very important role, how we are assessing what the learner has learned. So this is an example of an assessment criteria. This has been given by the NMC for the competency-based postgraduate training in the MD pharmacology. So this is a rubrics which can be used for assessing a portfolio. Okay. So briefly a summary, you collect evidence, you reflect on that evidence, it is evaluated by 1 or 2 examiners or depending on how many examiners you want to have in your department for the formative assessment. Then you have a dialogue between the learner and the examiner. And finally, the final assessment happens, which can be in the form of formative assessment or a summative assessment. So what are the benefits of portfolio-based assessment? It is a holistic assessment. That means it gives an overview or overall view of the student's development in that particular field. It includes reflections and self-assessment. It gives individualized feedback so that benefits or improvement can happen in a targeted way. Then it depicts your long-term goals, encourages critical thinking. It is preparation for practice, gives a real-world scenario, what is actually happening in the real world. It decreases the gaps between the learning and practices, and it also can be used for assessment of soft skills. So what are the challenges for portfolio-based assessment? Like I said, it is generally subjective. What one assessor feels that this is of more value might differ from another one. And yes, very important, it is time consuming. Creating and assessing a portfolio is a time consuming process. So how can we address these solutions? By implementing clear-cut assessment criteria, which should be predefined for a particular portfolio. And peer assessments can mitigate the subjectivity and distribute the workload. So after giving a brief overview of the learning portfolios and assessment portfolios, I just want to carry forward and just show you what are the type of portfolios which we can build up in pharmacology. First and foremost is the process portfolio. This is also known as learning portfolio, and it is a dynamic and evolving portfolio. It basically focuses on the tracking the personal growth and learning progress of an individual, which we are making during our residency. Then assessment portfolio, again, we have discussed this. These are more structured and they are less student-centric, and they're used for evaluating specific skills and competencies. So what is important is that assessment portfolio should align with the competencies which are present in the curriculum. So then we have showcase portfolios designed to display a person's best work and achievements. And we generally build up showcase portfolios once our learning has already happened, once we complete our residency and we want to show the best work forward. Then we can also have hybrid portfolios, which is a combination of showcase, process, and assessment portfolios. And in generally hybrid portfolios, we can move our artifacts from the process portfolio into an assessment or a showcase portfolio. So there are various other different types of portfolios which you can use, but I thought that these four are more important as far as our journey is concerned. So what are the best practices, how you can make a good portfolio? Well, first and foremost is organization. Keep your portfolio organized and well structured. It should be aligned with your learning objectives and goals. And very important that it should depict you as a person. It should depict your personal journey and personal growth rather than what we do in the logbooks. So what are the future aheads? The future is of, yes, digital portfolios. And with the advent of digital portfolios, we can use the help of artificial intelligence in assessing large-scale portfolios efficiently. So with this background, I just wanted to show you an example of a portfolio of a workshop. You all have seen this is the cover page of that workshop. This is an about me section. It can be about the persons, it can be about the workshop. This is the scrapbook of that workshop. Then if we add feedback and reflections to this workshop, it can lead to certain outcomes, which are improvement in UG teaching or improvement in PG teaching and better policy making. So please remember, portfolio is not just a collection of learners' work, but it is a collection of his best work. Developing a portfolio takes time, so it should be valued. And assessment is a way of giving meaning to the collection of best works and will give a feeling of fulfillment to the learner of a job well done. So I'd like to acknowledge the organizers of the workshop for allowing me to use their slides. And I'm also thankful to Dr. Tipendra Narang, who is a resident in my department, who helped me in making this presentation and agreed to be my muse for this presentation. So be dynamic, own your work. Thank you.
Thank you, Savita, for your wonderful presentation. With this, we have some idea about, to some extent, clear about the portfolio and how it differs from the logbook. You know, we have logbook in our curriculum. We have also the portfolios and how to
Yes, sir.
use. Am I audible?
Yes, sir, you are audible.
Okay. and how to use these tools, the logbook, portfolios, in the development of the system, or rather the learners. From these clarification, already Savita explained about the dynamic process of development of this portfolio, the reflections, what is reflections and how it can be incorporated, the components of portfolio. I think one of our learner raised the issue. I'm not entering this question about the components of portfolio. Already it is explained by Savita. If you share your slides, it will be it will provide the answer to the learner. Then artifacts in portfolio, then portfolio-based learning, portfolio assessment. All these embraces the overall concept of portfolio. But what is my understanding is that portfolio probably best fit for andragogy. The adult learning quality development, its maturity, along with the CBME concept, taking care of the objectives as well as the assessment. It provides a holistic form of the that means apex form of learning process. I think, Savita, will you include something that how problem-based learning can be incorporated in portfolio?
Yes, so your first question was what was the difference between logbook and portfolio? That's why I picked that. So logbook is a more structured document. It is a fixed document. We have already, logbook has been made mandatory in both undergraduate and postgraduate curriculum. And the structure has also been provided by NMC. So it just depicts, we give an example of BCBR course that it is one of the essential requirements. So it is just depicting that, yes, you did a BCBR course. Whereas portfolio is your own learning journey. It is about personal development and personal growth, and you are showcasing those skills to public through a portfolio. So in a portfolio, you are depicting, like I said, that after BCBR course, you are doing certain research work and then you are winning some prizes over there. So you're showcasing your best work forward. So in a logbook, it is already predefined. Student cannot do anything about it. But whereas in a portfolio, we generally in our assessments and during exams also, we ask students, what is your best work? What did you do in these 3 years? So if he has a portfolio on his best work, so it depends, it is a person's learning. It depends on the person, how much he wants to show about that learning. He can show about all the research work he has done or all the publications or presentations he has made, or he or she has made, or he can just depict the best work or best presentation, giving advantage to the learner. Secondly, what I could gather from your questions was about the reflections. So reflections, again, when we reflect on something which we do, it helps us grow as a person. We realize what we were doing and how we can critically improve that particular thing. So I personally feel that actual learning happens when we are reflecting or critically thinking about the process which has already happened in the past. So reflections give a personal statement to portfolio. So, and as far as content of the portfolio are concerned, I think it should have a cover. Basically, we discussed it should have a cover page. It should have an about me section because this is the personal statement of the person owning the portfolio. Then learning objectives or the goal of that particular portfolio. Is it a learning portfolio? Is it just showcasing your best work? Whatever the learning objective is for developing that particular portfolio. Then artifacts are the evidences of your work. Yes, we can include the problem-based learning also, because I just included few examples from the CBME curriculum as an artifacts. So the list is very small. You can extend the list to whatever you want. You can include whatever you are doing in those 3 years or during your development as a professional also after completing your residency. So we can use n number of artifacts in our portfolios.
Excellent. So it is a purposeful work by the student for self-directed learning. Yeah.
Yeah. And if somebody is building a portfolio, so I personally feel that as an assessor, if somebody is coming up with a logbook to me and if somebody is coming up with a portfolio to me, so I think I would give more emphasis to the portfolio because the students has put in so much effort in building up that portfolio. That means that he's or she is proud of the work which they have done.
Excellent. So I think with this, we have some understanding. So still, you may have learners, you may have a number of questions. it is usual. You please put it in the chat box, and I will request our organization, the National Association for Pharmacology and Therapeutics, to take care of these questions so that we can communicate with the learners. And I think we are in time. Again, conveying my thanks to the organizer and expecting another exciting academic journey in the next session. So handing over to Padmaja madam. Madam, please.
Thank you.
Thank you, sir. Thank you. So that was a crisp and lucid presentation. So as I promised you, you are in for another feast now. The next topic is reflective writing in assessment of pharmacology and therapeutics. Thank you, Dr. Savita Verma, for the presentation. Yes. So the next topic is reflective writing in assessment and of pharmacology and therapeutics. That will be by none other than Dr. Nirmala Rege. She is one of the senior most pharmacologists in the country. So we are privileged to listen to her, and to moderate the session, we have a very charming lady, Dr. Chitra Khanwelkar. Mr. Praveen Udupa, to please put the slide. Chitra Khanwelkar. Yes. Yeah, she's a friend of mine. She's a professor in the Department of Pharmacology, Krishna Institute of Medical Sciences, Karad. She has also completed her tenure as the HOD there. She has 34 years of teaching experience. She has guided many MDs and PhDs. She has 75 publications and 3 chapters in books. She has been awarded favorite teacher not once or twice, but thrice. She is a member of MEU, chairman, Institutional Animal Ethics Committee. She's a life member of NPT. That is, we are proud of her. And also, okay, the last part I'm not able to see is, she's also a reviewer of many medical journals. Yes. So, welcome to Dr. Chitra Khanwelkar, and over to you, madam, to take over to moderate the session.
Thank you so much, Dr. Padmaja madam. Am I audible, madam?
Yes, you're audible.
Now, can I request the technical person to share Dr. Nirmala Rege madam's slide, introductory slide? Now, at the outset, I would like to thank the organizers of CBME 4th series of webinars for giving me this opportunity to moderate this session on a very important topic, which is still remaining unexplained to many of the pharmacologists, I think. And that is the importance of this topic. And I am privileged and honored to introduce today's speaker, who is a renowned pharmacologist, a great academician, and also a great researcher. And more importantly, she is a very good human being. None other than Dr. Nirmala Rege. Going to her academic qualifications, she is MD Pharmacology, DNB Clinical Pharmacology, PhD Pharmacology, and also a Savita Fellow. Presently, she is working as Professor of Pharmacology, IRAS Lucknow Medical College at Lucknow. But previously, she is also a Professor Emeritus at State GS Medical College, KM Hospital, Mumbai. And she is an adjunct faculty, Institute for Inter-Health Professionals Education, Sri Balaji Vidyapith, Puducherry. She is executive member of Academy of Health Professions Educators, advisor and past president, South Asian College, which is affiliated to the American College of Clinical Pharmacology. She is a member of expert group of UG Medical Education Board, NMC, faculty of JSMC FEMER, and she is also faculty for the research methodology workshops of MUHS. She has authored the very important and very popular book. Since my undergraduate, I was using this book that was called a Saposkar book, but now it can be called as Rege's book, because under her noble and able leadership that has completely transformed, and now it is apt book for the CBME curriculum. She has also authored a precise practical pharmacology book. She is co-editor for Art of Teaching Medical Students and editorial board member of Medical Education Research Area, Practice, Publication, and Scholarships. She has 125 publications to her credit in national and international journals, and her field of research it is vast. It is in experimental pharmacology, clinical pharmacology, medical education, and Ayurveda. Now, I welcome Dr. Nirmala Rege Madam to present her presentation and enlighten us with the knowledge about the on the topic reflective writing in assessment of pharmacology and therapeutics. Welcome, Madam. Over to you, Madam.
Thank you, Chitra, for that kind introduction. And may I present my slide?
Yes.
I thank National Association of Pharmacology and Therapeutics, Dr. Padmaja, and I can't see my presentation. Can you see?
Share, Madam. Please share it.
Yeah. Yeah, I will go on the slide.
Visible now.
And just one correction, Dr. Satoskar is still the chief editor of his book.
Yes.
Sir is 95 and very, very active at this age also.
So,
my topic is reflective writing.
Can I request the technical person to start the chat box? It is blocked. It is probably blocked. The chat box is blocked. Please open it. For the
Yes, ma'am.
Yes. Okay.
Yeah.
Thank you.
Okay. So my topic is reflective writing in assessment of pharmacology and therapeutics. The objectives for this, at the end of this session, the participants shall be able to define reflection and reflective practice, discuss the benefits of learning to reflect. I will be touching upon little bit on the process of writing reflection, state the purpose of reflection assessment, be aware of the tools which are used to assess reflection, and challenges in assessment. And now let's start from the definition of the reflection, because I was told that this is that there will be postgraduate students and some of them they are not aware of this topic. So it is I will read it first. It is a metacognitive process that occurs before, during, and after situation with the purpose of developing greater understanding of both the self and the situation, so that the future encounters with the situation are informed from the previous encounters. And metacognition is, we have to look at the words which are colored here as red, that metacognition is not just the thinking. So reflection is not just thinking what I did and what happened. So looking at the experience and then consolidating it as we usually think, but it is also to ask ourselves how and why I think and feel the way I do. And it can be done before the experience, during, and after. So it could be reflection in or reflection for, that is before, or it could be reflection on whatever has happened. And it is very clear that it will be understanding of both self and situation may not be tackled with, because that has already taken place. But in future, if you come across the similar situation, then what are the changes to be made in self should be thought over. But when we are defining reflection, we have to think about both the things. It is not just the cognitive domain that where you are synthesizing, you are recollecting, you are evaluating, and analysis as what has happened. But many a time, our actions, they go with our feelings and emotions. We learn better when we like particular thing. When there is a passion, we understand it better. And when there is a boring thing or we don't dislike something, then naturally we don't learn. So feelings are equally important. And remember, as a faculty, we are giving various learning experiences to our UG students or our postgraduate students. But we don't learn from the experience. We learn from reflecting on the experience. And that is why these reflections are important. I would like to ask the participants of this August gathering, why should one learn to reflect? Or why should we teach our students how to reflect? Can you please put in the chat box or unmute yourself if you can and let me. May I know?
No, still there is no response, madam. Yeah, to evolve. First response by Shruti saying it is to evolve. Good presentation, what they are saying.
Yeah.
Communication to what we know. self-correction,
For self-introspection, self-correction, improvisation. Making sense of the experience. Very nice. So this is essential for our learning. So when we understand our actions or reactions better to any experience, then it helps us to develop the new knowledge or the skills, and we learn how to apply it also, because we think about how to apply it, what's went wrong, what are the mistakes we have done in application. We also identify our own skills and strengths, and we understand what learning has taken place. We also try to understand the learning needs, what we have to do, and we can develop the options and actions for change and future success. So reflections are definitely required for learning. They are required for our professional development. We are saying that for our CBME, we have to take the students from a novice state to the advanced beginner, then to a competent one, and to expert. How this will take place? Because unless they identify their own learning needs, unless they develop the plan for that, this development will not take place. And even for the expert level, during all these learning curves, we gather so much of material, but everything may not be necessary. So you have to have the mental models which you can visit very quickly and use that particular thing in decision making. And our situations in the medical field is usually very, very dynamic, very, very complex also. Reflections are needed for the therapeutic relationship between doctor and patient. And this time in our CBME, we are training them how to deal with the patient, how to communicate the patient, the drug, drug use and all those things, how to make adherence to the drug. But while during this communication, maybe our values, what we are thinking about, it may not match with that of patients. Now, naturally, we are many a times having simulated patients and not the real patient. But in long run, they will be facing their real patients. And in that case, we have to think about, suppose we are getting irritable when we are encountering a particular situation or any human relationship, we have to ask ourselves why this is happening. Is this something I'm doing wrongly? Is this by nature? What should I do? Because if we get bogged down by those emotional aspects, then we may not be able to take the important decision, which as a pharmacologist, we have to take at many places. And with this particular thing in mind, the CBME has introduced reflection in their course. In fact, the IMG has to follow those 5 roles are important. There are competencies, global and subject-wise have been specified. But the backbone is mentoring, feedback, and the self-reflection. And that is why we have to teach them the reflection. Now, it is not just the thinking of what has happened. If you don't put it into action, it's not, nothing will happen. And therefore, the reflective practice is the one which links what is the reflection with the action together. And if you can see the feelings, thoughts, and ideas, which is reflection, their connection with the action or tendency is by that double arrow, the double-sided arrows. And therefore, anything can change. The feelings can change the thoughts, thoughts can change the feelings, and both can change the action. And that transforms into our behavior. Now, why we have to ask them to write? Reflections can be by verbal also. You can ask them to tell stories, and you can ask them to visit some digital media and express in different ways. But writing helps us. And how it helps? Because when we are thinking, there may be a chaos. Students may not be able to think coherently. But when you ask them to write, it may become a very logical piece. It cements the ideas and they can remain focused on that. It brings a lot of clarity, and they will be able to connect the dots and then decide what could be the path forward. Because if they want to make some changes, if they want to, based on their learning needs, if they recognize, they have to have the option, which they will be able to do. And then it will build in some discipline in their approaches. So it is something that they are thinking with their pen and pencil, and that thinking is evident to us as teachers. And this writing is a skill, it is not a talent. And the difference is very, very important because skill can be improved by practice. So we have to encourage them to write so that they will, while writing reflection, they will start reflecting in a better way. Now, what we should ask them to reflect upon, there are so many things, and reflection can be on anything in the curriculum. Where I have just listed some of the things for the UG curriculum and PG curriculum, but it depends on the faculty what to select. It could be a real scene, it could be an imagined scene. So for UG, it could be the observations which are there in the ward or OPD or on the role play while prescribing a drug or administering a drug. It could be an experience or event like the self-directed learning is something, new sessions are there. So or pharmacology, clinical pharmacology practicals are new. Field visits in pharmacology, or while they are going for the communication medicine, they can look at the drugs and which are given to those families, and they can write a reflection on that. It could be on the OSCE, which is again new in pharmacology, or as Savita said, on the pharmacovigilance program when they are involving them. And recently I've seen many of you have involved them in various pharmacological and they were very creative programs, so they can reflect at the end. Then interactions. Maybe the simulated patient or real patients like Dr. Swanan told us last time in the skill lab. It could be just a passing thought or something comes to their mind, like on the mechanism of action of drugs, drug names. It could be the meaning of that incident. They have seen a case of adverse drug reaction or some death in this because of the drug, or it could be the simulation. And it could be the personal life. They may have experienced something because of the medication. Because we don't want to segregate it from pharmacology, let it be for medication related. Something happened in their family, something they themselves have undergone when they are sick and they were given the drug. And same thing for the postgraduate curriculum where they are going, attending the EC meeting, or they are going for the drug therapeutic committee. They are members who are, they may not be the members, but they may be attending those committee meetings with their guides, or clinical experimental study, their rotations in the industry, scientific events, assignment. You think of anything. In fact, the theory or their thesis work, their word posting, or even the title of their project, and their hospital pharmacy, we are a part of it. So their drug purchase scheme, and again, there's something related to their personal experiences. There are conversation with the clinicians as well as their guide. And there are various models are available. So it is always better to provide them the framework, which Dr. Savita mentioned about this roles minimal model, that what happened, so what, and what next. But there is another model also, which is a little bit more exploratory, which is a Gibbs model, which asks for the description, then it asks for the feelings, what were you are thinking and feeling, asking for the evaluation, what was good and bad about that experience, then asking them to analyze what sense they make from that situation, and then what could you have done in that particular situation, and some action plan. Suppose that situation occurs again, what would you do? At ERA, we have, you can have your own template for that. At ERA, we went through the 3 or 4 different templates and we frameworks, and we have our own template, which we have posted it in their journal, where we have given those questions, but what they have to write, we have kept the empty space below that. They have to write their reflection as a free flow and not answer to each one of the questions. Now, what is the purpose of this assessment? Remember, reflection are not to assess the subject competency, because these are their own perception, their own thinking. But what we are assessing, their ability to reflect, which will in long run will help them in the self-directed learning, or they will become a lifelong learner, and their ability of communicating in writing. So both the things we can assess from the reflection. Also, we ask them to write reflection because to assess what type of feedback they are giving us, which may be relating to their, we want to give them. So it could be related to the reflection, it is related to their writing, and they would like to receive feedback from them also, which may be related to our curriculum. So how we are teaching, how we are, what they like about a particular teaching style, media which is used, or the educational environment itself, means whether it was supporting or not. Or it could be their perception, some hidden curriculum, they learn something from somewhere. Like our students will say that, okay, pharmacology is always very difficult subject, and because they have just learned and from the seniors before even get exposure, they know that this subject is very boring. So now to change it and this it, there may be many more things to it. And this what they learn being in our department or in our institution, which is not a formal learning. We would like to know about it so that we can, it's looking in their mind, in fact, and make the change. Now, what should be assessed? Naturally, if we are asking for some assignment or this, then the task and product, what they are writing about it. It may be the process, what they are coming across, the practice they are following, and their personal development. And as I said, their opinions and preferences. Little bit about their personal development. We would like to see their feelings and emotions, whether they are afraid of something, they are scared, they are enjoying something they are finding boring, or what finding very useful. If we have introduced some new things, then what they, whether it is acceptable or not, those things we can see. We can also get idea about their perception of their knowledge, skills, their expectation, some alternatives they are thinking, and sometimes the out of box thinking also. They may think about the title and then they will start thinking about the various ways. We are also interested in finding out what are the difficulties they are facing, or what are the barriers, and how they are trying to deal with their barriers. We are not going to change all the barriers. It may not be possible. They have to overcome them, but how they are making the decision, and then the role and their understanding of their role, their understanding of their responsibility, whether they are thinking their some sense of worth or their confidence in it. They're thinking that they're fitting into this medical profession. All these things are over a period of time. Can we see some change from when they are going from novice to the competent? That if we, it has been told to us that the portfolio or logbook should be kept, so that you, if you want to see what changes have occurred in your own student, you will be able to see through their reflection. Now, when the person is writing reflection, the person may not be a very competent one. As you see on the extreme right side, he may not be a true reflector. He could be a recorder. He will be just writing down what has happened. He will be writing down the description. But on that left side of upper quadrant, if you will see, sometimes it may be some little structured, and but it is not necessarily reflecting. And on the other side, it may be some reflection will be there, but it means little less, not a perfect one. Whereas we want them to go from that descriptive side to the reflective side. And while doing that, there will be, we want them to focus on the product as well as on the process. So we want to, while finding out whether their ability to reflect, we would like to know the depth of their reflection, whether it is superficial level 1, that is just the descriptive writing, or it is a level 2. There is some description is there, but it is associated with some reflection. It could be level 3 writing, which is reflective writing 1, where there is a willingness to be critical of the action of self. Because when you are writing the reflection and we are saying that you are reflecting, you should be, as I said earlier, it should be why and how we are thinking the way we are thinking. In doing so, what we are doing, we are trying to question our own assumptions, our own values, because based on that, we are doing some action. Now with them, we want them to see that whether they are doing that or not. And the level 4 is a very critical reflection. The critical reflection is nothing but the person is developing awareness of his own beliefs and his own development. And that can come from looking at the perspectives of others. So whether they are taking into consideration or they are putting their foot into others' perspective and they're thinking about it, or they are directly talking, having dialogue with their peers or their patients, or they are doing some literature search and they are coming out and writing. So that is a metacognitive stance, whether that is taken, others' views are taken, and their role on the emotion in the art of reflection is understood. So one can go from level 1 to level 4, and with the hand holding, we can take them for this surface reflection to a deep one. And as I said, that they have to take their own perspective, viewed by the colleagues and peers, by the patients, or from the literature. There is one tool which I have used extensively, and that is by Moon in 2004. And as if you can see the arrow which is on the left side, which is pointing upward. And there is it goes from grade F, which is the lowest grade, to the grade A. So grade F is the poor description. They are not even able to write the reflection. And that is, there are many grammatical mistakes. There is no coherence. So that is a grade A. Grade E is a describing an event, but there is no interpretation of that event. Grade B is something which is describing an event, recognizing that there is something important, but they are not explaining why. And then grade C is little further, that they are recognizing their feelings and thoughts and comparing with the previous experience. While grade B and grade A are the going towards the reflection, which is critical. The one involving the judgment, what went well or less well, and why that is happened. And then grade A is looking for that, what is to be changed and how it is to be confirmed. So there is an explanation how to respond to a future. And it is an explanation to respond, and not just saying that I will do something in future, but why and how that should come. Now, this is a very holistic type of thing. All descriptive one, not this. But you may think that you want to have at every level, that how they are writing and how they are, whether what is the depth. Similarly, what could be the breadth of the reflection? So whether from that event, whether they are, maybe it is something related to the project, very technical, but they are having a societal context while going that is a breadth of reflection. So one can use the rubric. But for each this thing, for each criteria which are there, like mechanics, accuracy, clarity, relevance, one should have the descriptor. If you ask me if there is a ready-made rubric, then it is there. There are many, in fact, but this is the one again which I have used, which is called as reflect rubric. And they have also put that the 4 levels. One is habitual, that is, it is not reflective, more of a description. Introspection with little thoughtful action, and the reflection and critical reflection. And for this, they have given a table in the appendix, what each level means and what is the description. And as you can see here, there are criteria mentioned, which also go from the writing spectrum, the presence of self, because that is very, very important. It is not a third person is looking at the event, their own involvement, whether they are describing that conflict or their dilemma, disorienting dilemma with it, attending to the emotion, their analysis and meaning making, and they have kept an additional or optional criteria like the attention to the assignment if it is given. So you can use this. Anyway, the slides will be shared, so you can use it. And they have given a case where you can, using their rubric, you can see the case and then see the discussion which they have made. This is another level, which is by Bain, and he has put the reflection into 5 levels. Level 1 is reporting, level 2 is responding, level 3 is relating, level 4 is reasoning, and then the reconstructing. And he has taken into all the 3 things into focus. One, as I said, the profession or the practice, what they are doing. The second one is the project. And the third one is their self, the person at a level. So it could be at a description level, which is the lowest level. But sometimes they will observe something and add to that description. So their observation. And sometimes they will respond with their feelings. So that could be the response. At times, Some students will go a little further and they will get engaged into the project, describing it in detail, why this happened, why it couldn't happen. So their explanation. And then some students will go a little further and start thinking about their roles. So they will evaluate what their responsibilities, what they have done. And maybe while evaluating it, they will start evaluating the this thing, not just the related people who are involved in that project, but their own strengths and their own weaknesses and how to improve upon. So that is a self-evaluation. Some students also, while they are doing to some generalization, okay, I have seen this particular thing and this thing happen. And I got very much disappointed because I couldn't do that particular skill in the skill lab. But it may happen in future also that I may get in while doing a practice, I may get similar situation. I may not be able to do it. And I have to overcome that and I have to go ahead. This is their generalizing from one skill to the what happens in the practice. And some students will have some out-of-box thinking. They may find something new way, that is a theoretization. And when they are evaluating all their project, it could be critical review. So you can have a different level that students may be different. Now, when we talk about the challenges, many a times when I've presented, people say that we have 250 students and their number of students per batch are so many that we can't go on reading each and everything and it will be too much of work. Or the time, where is the time available? The students are with us for it. Now, for this, I feel we have to select the experiences on which we want them to write. See, in pharmacology, I feel even if they write 3 reflection, it is good enough. Remember, there are 5 other subjects which are taught in the same time, means I'm including still the forensic medicine and community medicine, and they are going on the clinical side and they will be having writing reflection on that. So it will be too much time which they will be spending if they have to write a good reflection. So select the experiences and select the number of experiences on which you want them to write, which you feel will be important from their learning. Secondly, we have to see that what are the student preferences and perception. They may be fearing that what the teachers will say. If I talk something related to the style of a teacher, or if I say that this section I didn't like, what will be the repercussions on me? Or they may feel very, very uncomfortable about it. Both, one more thing which I have to tell before I go for this student, I feel that we should involve all. One person should not see all 250 students' reflection. It will be definitely impossible. But for any college, we have 1 professor, 2 associate professors, 3 tutors, 3 assistant professors, and there are 4 tutors. So there is a group of 12 people. Involve all. And even if you are a postgraduate student, train the postgraduate student. And you have a discussion also. So there should be faculty development program. And after correcting or after assessing, I should not say correcting, after assessing the reflection, call for a departmental meeting and everyone can express their views. We are on the learning curve. How many of us have written the reflections per se? So those who write the reflection, I enrolled myself for this reflection. It is very, very difficult to write. So we are now don't want to be them to become critically refractor at this stage, but we are taking them forward. And regarding the student preferences for the students also, we have to take session for them. In ERA, we take it at the foundation course itself, and I'm sure you must be also doing that. So, and the entire environment should be supportive. It is not something, otherwise they will not express only. And the language is something which is, okay, so allow them to write in the language they prefer. Perhaps not is some language which we don't understand, but you can keep the language, their own mother tongue. It may be difficult because our students are now going everywhere, but the national language and English, at least 2 preferences can be given depending on the students. So give them some preference to express themselves. The question comes about the feasibility and acceptability, which I have told you earlier in this discussion, but the reliability of the assessment. If different people are evaluating, will that be a reliable one? Perhaps not at the earlier stage, but you get a reflection where everyone is present and your scores are coming together, then naturally you will say that, okay, what I'm assessing is reliable. But to reach that reliability, we should be expert in the assessment. And we can do that for these early years of CBME so that we will also learn and our students will also learn. And definitely we have to give them the feedback to the students, as I said, and we should take their feedback in a very positive way and modify. If we have to modify or we have to correct ourselves at places, it is a win-win situation and we have to look at it in that particular sense. Thank you. And if there are any questions, I would like to take them.
Thank you very much, Rege Madam. It was a very elaborative and nicely presented presentation about this reflective writing. I can't see any question in the chat box. But if anybody wants to ask the questions, you can put it on the WhatsApp group and Madam will definitely give answers to those. Yeah. Okay, now they are coming now. Manjunath says, I feel it's a very artificial process.
Yes, Dr. Manjunath, if you are saying that it is very artificial, because yes, at the earlier stage when they are doing it, it is artificial. But remember why we are doing it, because everyone learns how to reflect by trial and error method. And some of them, they will learn to reflect, not just the students, I'm talking of ourselves also. We are doing it by trial and error method. We are teaching them the process. And during this process, it may appear artificial in the beginning, but once they start doing it regularly, they may learn it faster and then it may not be artificial. It becomes something which is inbuilt into them. That we want to take them to that particular stage, which may or may not happen when they are in our with us with the medical profession, but I'm sure it will happen in the long run. All experts in the medical field, they or all professionals, as I will say, who have got high caliber, all of them, they reflect, they may not be writing it down, the reflections.
Another question is by Dr. Shruti Singh. Teaching reflections to students will be aided process initially. Can we have some ethical issues to the process?
I didn't get it. I don't have the access to the chat box, no?
Ethical issues, yeah.
Okay, I have. One second. Which one you are saying?
Shruti Singh.
Yeah, Shruti Singh. Ma'am, teaching reflections to students will be aided process initially. Can we say some ethical issues to the process? Maybe there will be some ethical issues will definitely come in, because some confidentiality, as we say, that may not be there. But the reflections will be seen only by those teachers, and we have to maintain the integrity in that sense. We are not going to paste their reflections on the notice board or something. We are not going to keep the grades over there. So I don't think that there will be a major problems will be encompassed. At least not reported. I haven't read anywhere. What important topics should we take for reflective writing? Because it is also time. I have told you the topics, so you have to discuss at and when the slides will circulated, you will get the topics so that you can decide what you can do. Personally, I feel whatever the new things you have incorporated in this CBME, you can take up those, because we want to know their feedback on that, like this BCBR program, which Dr. Savita was mentioning about for the reflection. If we collect the reflection and if we that feedback from the student on their BCBR program, and if we publish that article, it will be, or if we forget about publishing the article, if you send it to the NI, the National Institute of Epidemiology, it will be of great help to those people also in modifying their program. So that can be done.
Madam, there are few more questions, but I think you can answer to them in
I will answer them in our WhatsApp.
We are already exceeding the time limit. Okay. Thank you so
Yes.
much, madam, for the elaborative presentation. And thank you, Dr. Padmaja, madam, and the organizers for giving us the chance.
Thank you all. Thank the speakers, the moderators, and all the participants for making this session a wonderful presentation, madam. We had a nice, real reflective.
Thank you for
Yes.
giving me this opportunity.
Thank you, madam. Thank you.
Thank you so much.
We will be closing. Thank you all. Thank you.